हेलो एवरीवन, वेलकम बैक टू द चैनल मेरी जर्नी। आज हम डिस्कस करेंगे स्कैपुला के बारे में। स्कैपुला के साइड डिटर्मिनेशन, इसकी एक्सटर्नल फीचर्स एज वेल एज द मस्कुलर एंड लिगामेंटस अटैचमेंट्स। ओके, सो लेट्स गेट स्टार्टेड। The scapula is also called as the shoulder blade. It is situated posterolaterally in our body as I'm holding in this position, and it is a type of flat bone. Okay, as you can appreciate, this anterior and posterior is flat. So starting with the side determination of the scapula, the lateral glenoid cavity should face laterally as it articulates with the head of the humerus to form the shoulder joint, and the costal surface, which is concave, should face in the front. The dorsal surface is convex and it should face backward. The lateral border is the thickest border and should face laterally. Clear? Now, so this is the side determination, and from this point you can find out that this scapula is of the right side of our body. Clear? Now we start with the external features of the scapula, which has the two surfaces, the three angles, the three borders, and the three processes. The two surfaces are as follows: the ventral surface, also known as the costal surface because it is in relation with the ribs and the chest wall. The dorsal surface, which is convex and is placed dorsally in our body. It is divided into further two parts by this process of the scapula called as the spinous process of scapula. The spinous process of the scapula divides the scapula dorsal surface into the upper smaller supraspinous fossa and the lower larger infraspinous fossa. These supraspinous fossa and the infraspinous fossa intercommunicate with each other through this spinoglenoid notch. As you can appreciate here, this is laterally placed spinoglenoid notch. The supraspinous and the infraspinous fossa intercommunicate with each other through this spinoglenoid notch. There are the two notches present in the scapula. First one is the spinoglenoid notch. Clear? Okay, so this was about the ventral and the dorsal surface of the scapula. The ventral surface also has the three longitudinal ridges, which are not much appreciated in this artificial bone. Okay, the ventral surface is also called as the subscapular fossa. This is also called as the subscapular fossa. So these are the two surfaces of the scapula. Now we start with the borders of the scapula. The borders are of three in number: the superior border, which is the shortest border; the inferior border, the medial border, which is placed medially and is thinnest border; the lateral border, which faces laterally and is very thick in its mass. It extends from the infraglenoid tubercle up to the inferior angle of the scapula. The medial border extends from the superior angle of the scapula till the inferior angle of the scapula. Clear? The superior border also has a notch, which is called as the suprascapular notch. This is the suprascapular notch, which is converted into a foramen with the help of a transverse scapular ligament. The transverse scapular ligament converts this supraspinous notch into a supraspinous foramen. मीन्स ये ऐसे कवर हो जाएगा, इसके ऊपर से सुपरास्कैपुलर आर्टरी पासेस एंड इसके नीचे से द सुपरास्कैपुलर नर्व्स पासेस फॉर द sake of protection of the nerve. Is that clear? Okay, we have talked about the borders. Now we see about the angles. This is the superior angle of the scapula, which is covered by the trapezius muscle. This is the inferior angle of the scapula, which is covered by the latissimus dorsi muscle. This is the lateral angle of the scapula, which is broad and has the glenoid cavity. I hope this is clear. Above this glenoid cavity there is the supraglenoid tubercle, and below this there is the infraglenoid tubercle. Clear? So these were the three angles and the three borders. Now the three processes we come to. The first one, which is placed dorsally, is the spinous process of the scapula. The spinous process of the scapula continues as the acromion process. Acromion means it is the expanded plate-like structure. It is placed highest in the position. Okay, that is the acromion process of the scapula. The third process is the coracoid process, which is just bent just like a crow's beak. Is that clear? Now we discuss about the spinous process. The spinous process has the anterior border, which is fused, the posterior border, which has the crest of the spine, which is also known as the crest of the spine, having the upper lip and the lower lip of the crest of the spine. This continues with the acromion process laterally. This was the spinous process having the superior surface. This is the superior surface, and this is the inferior surface of the spinous process of the scapula. Then we talk about the acromion process. The acromion process has the superior surface, the inferior surface, the medial border, and the lateral border. Clear? The acromion process is expanded plate-like structure and is the lateral continuation of the spinous process of the scapula, having the superior surface, inferior surface, the medial border, and the lateral border. The coracoid process The coracoid process is just like a crow's beak, has the superior surface, inferior surface, the lateral border and the medial border. The coracoid process also has the root. This is the root of the coracoid process. Clear? Then we talk about all the processes are included in this, like the 3 processes are included. Then we discuss about the muscular attachments of the scapula. We start with the muscular attachments along the ventral surface of the scapula. The first one, this is the subscapular fossa, which gives rise to the subscapularis muscle, which is a multipinnate muscle along its medial two-third. Along the medial two-third, the subscapularis muscle originates from the subscapular fossa. And on the dorsal surface, this supraspinous fossa gives origin to the supraspinatus muscle from its medial two-third along with the superior surface of the spinous process. The infraspinous fossa gives origin to the infraspinatus muscle along its medial two-third, including the inferior surface of the spinous process of the scapula. I hope this is clear. These 3 are the major muscles which are originating from the surfaces. Then we discuss about the lateral border of the scapula and its attachments. The lateral border of the scapula gives rise to the teres minor in the upper two-third, and the lower one-third gives origin to the teres major. The teres minor originates from the lateral border, upper two-third of the dorsal aspect of the lateral border of scapula in the form of 2 slips. That is, the 2 slips of the teres minor originates from here. In between, the circumflex scapular artery passes. The teres major originates from the lower one-third of the dorsal aspect of the lateral surface of the lateral border of the scapula. Then we discuss about the medial border of the scapula. Levator scapulae, there are the insertions on the medial border of the scapula. The levator scapulae is inserted onto this surface on the superior angle up to the root of the spine of the spinous process. This is the spinous process up to the root, and the superior angle, there is the levator scapulae being inserted here. There is the root of omohyoid, inferior belly of the omohyoid being inserted near the root of the suprascapular notch. Clear? Then opposite to the root of the spine of the scapula, there is the rhomboid minor which is inserted. Then rhomboid major is inserted along this whole course from the root of the spine of the scapula till the inferior angle on the dorsal aspect of the medial border of the scapula. This is the rhomboid major, the levator scapulae, rhomboid minor, the rhomboid major. Inferior belly of the omohyoid muscle, clear? Subscapularis, supraspinatus, infraspinatus. Done? Okay. Then we talk about the latissimus dorsi, originating from to the inferior border of the scapula. The trapezius inserting along the superior border of the scapula, and this spinous process has the upper lip giving rise to the insertion of the trapezius muscle along the upper lip, and also the medial border of the acromion process. The lower lip and the lateral border of the acromion process gives rise to the multipinnate middle fibers of the deltoid muscle, which helps in the abduction of the arm from 19 degree to the 90 degree. Clear? Here there is origin of the deltoid muscle, and there is the insertion of the trapezius muscle along the upper lip of the crest of the spine along with the medial border of the acromion process. So basically these were the muscles originating and inserting on the scapula. Then we discuss about the triceps and the biceps muscles. The long head of the biceps brachii originate from the infraglenoid tubercle, and the long head of the triceps brachii originate from the supraglenoid tubercle. Clear? Okay. Then we talk about the ligaments. There is the transverse scapular ligament, which converts this suprascapular notch into a foramen. Then there is the coracoacromial ligament, which passes from the lateral border of the coracoid process till the tip of the acromion process. This is the coracoacromial ligament. Then we have the coracohumeral ligament passing from the root of the coracoid process, which goes till the humerus. This is the coracohumeral ligament. Then there is the coracoclavicular ligament, which has the 2 parts, the trapezoid part and the conoid part, which attaches on the tip of the coracoid process. There is the pectoralis minor muscle inserting on the superior and the medial aspect, and the superior aspect of the coracoid process. Then we have the pectoralis minor over here. Then the coracobrachialis originates from the tip of the coracoid process. Thank you so much. I hope you understood.